My name is Francisco Rojas. I am obstetrician and gynecologist. I work for Johns Hopkins Community Physicians at Baltimore and in Howard County. Some patients could develop pregnancy-induced high blood pressure during pregnancy. That disease is very common and could be very, very dangerous. If for any reason you develop headache that is persistent and is not going away with 1,000 milligrams of Tylenol, you need to contact your doctor. That's especially important when you develop additional symptoms such as visual changes, for example, blurred vision, or flashlights in your vision, or dark spots in your vision that last more than few seconds. All of those are associated with a condition that we commonly call preeclampsia and obligates to a more formal evaluation by your doctor, sometimes at the hospital. It's very important to contact your doctor 24/7, anytime, if you develop some symptoms. For example, any temperature above 100 Fahrenheit is considered fever during the pregnancy and is a reason to call immediately your doctor. Doing that could save the baby's life. Because remember, when you have fever, you become an oven, and what is cooking is the baby. In the same way, any amount of blood that happens during the pregnancy should be notified to the health provider. There are many instances when the mother could have a little bit of vaginal bleeding, and it's not necessarily too dangerous, but we prefer to believe that it's abnormal, and as a responsible physician, we want to be notified to intervene and protect the mother as much as possible. Another reason to call immediately your doctor is if you have leaking of fluid through your vagina that you don't know where it's coming from. If you are not sure, it's important to empty your bladder and check again. If during the next 30 minutes you realize that there is definitely an additional moist that you don't expect, please contact your physician, your OBGYN, and we will evaluate if there is a possible rupture of membranes or not. Contractions are normal during the third trimester, and patients can feel them like a tightening, pressure, or sometimes a little bit of cramping. However, these contractions shouldn't be more than 4 in an hour. When you start having tightening, pressure, or even cramping in your back or in your abdomen that is coming and going, lasting around 60 seconds, a minute or less, you need to suspect that those could be contractions. If they are happening more frequently than 4 or 5 in an hour, in other words, more than 1 every 15 minutes, it's better to contact your provider in order to rule out the possibility for preterm contractions or even preterm labor. Many over-the-counter medications are not tested for safety during pregnancy. Then, in general, please abstain to use any over-the-counter products. However, if you feel the need to get any of them, just contact your doctor, and in general, obstetricians will provide you with a list of safety products that you can get over the counter. For example, Tylenol in case of headache or mild pain, antihistaminics, stool softeners, Many of these medications have been used for many years, and they prove to be relatively safe. In general, obstetricians prefer that you avoid any medication before 13 weeks. But if it's necessary to use something, please be sure that you talk to your health provider first.